Well, welcome to Integrated Health of Indiana's Talk at 10, where today we're going to be discussing lower back pain. We're going to discuss several different types or reasons why people have low back pain. And I'll show you some demonstrations, or not demonstrations, but I'll show you just some of the anatomy. And first off, let's talk about one of the dirty little secrets that every doctor knows, but nobody really talks about. They did a study and they were looking at disc bulge because everybody hears about the herniated disc. They all hear about the disc bulge, sciatica, and all of this stuff. And so the dirty little secret is they've gone out and they've actually sampled the population, and this is where they get the statistics that 80% of people will have back pain when they're walking around. And so when you go sample the public, if they grab 100 people, 80% of these people will have 90% of them will have a disc bulge. So a bunch of them will have one of these little things right here. And that disc bulge, when the nerve gets traction to cross there, and you got to remember this area, the space doesn't exist. So there's muscles through here, there's blood vessels, there's all kinds of things on or in this space that cause pressure. And so to actually cause the body or a nerve actually to misfire, it takes what is called 9 millimeters of mercury of pressure. So what is 9 millimeters of mercury of pressure? If you take your finger and you push it into the side of a grape with as little pressure as it takes to dent that grape, that's how much pressure it takes to make a nerve start to fire off. So when you have one of these things outcropping, swelling, and hitting a nerve, the thing that happens to us is we start to feel that pressure. We feel that tightness. And this is an actual physical structural reason for that. As you can see, the back is supposed to have a lordosis. A lot of people will come into me chiropractically and that lordosis is gone, or they come with an anterior head tilt. And when you start to take the head and move forward, you increase the pressure on the low back. And the disc is very good at taking pressure up and down, and it can take rotational pressure, and you can even do lateral bending, and it does a pretty good job. What the disc does not do very well is when you bend and twist, and that creates a shear force. And that shear force will start to make those things kind of herniate. And that's where we start to get a big problem. And those are all structural reasons for lower back pain. So treatment for that's pretty easy. Chiropractors are fabulous at adjusting and decompressing the joint. So if we start to look at things, so ridiculitis. So when you have pain radiating down the legs and down the back, that's called a ridiculitis. A true sciatica is burning down the back of the leg that causes you pain, and a lot of people will feel that and they'll limp and they'll go along. Disc degeneration will cause issues. When we look at a degenerative animation, you can start to see that they lose the lordosis, and as they lose the lordosis, you can see those discs starting to shrink, they dehydrate, and this is where you have to have, honestly, good nutrition also. And that's where we start to see that disc loses its height, starts to go. You got to remember this portion of the disc, there's not a lot of blood that goes to that. That gets its nutrition through passive diffusion. And so when you have that, and you start to get those things, everything's got to be on point. And so we start to really look at, what causes or how can we rehydrate the disc? How can we take enough pressure off of the body, talking about homeostatic load? How can we take enough pressure off of the body so that this starts to heal up? And once again, looking at that disc issue again, wow, that's a strong magnet. You start to see the herniation hitting the nerve, and that will cause pain. And that pain will radiate out and will shoot down. So then what you have to do is we have to get in there and we have to decompress that. And so if you've been to a chiropractor before and you get that side posture and the back pops, those things are the things that starts to decompress that joint. And as you see the adjustment happen here, ooh, man, everything's backwards on this. Oh, let's do that again. Get the keyboard off of there so I don't put up funky stuff. Now let's look at that again. And so as the doctor adjusts the spine and he goes down in there, you start to see the skeletal bones will separate and allow that to suck that back in there. You can also do that with decompression. And so when we start to say the adjustments hurt too much or they are having a problem, I forget where this is at on here. Here's a couple more things going into what happens. So a lot of my patients will have what we call Piriformis Syndrome. And so there's a muscle that's right in here that goes from the sacrum out to the femur, and that's called the piriformis muscle. And that muscle will tighten up. And when that muscle tightens up, this is what you see happens. Need to get, there we go. Better. And that's the piriformis muscle. And as that thing goes into contracture and it hits all around there, see those nerves? Those nerves all start to fire off, and that causes a lot of pain. And I have a lot of patients that we will go in here and we will do trigger point work, trigger point therapy on this, causing this or allowing this to relax. But if you have stuff in the spine where it's twisted, then what happens is you're not getting everything released and all the muscles stay kind of tied up. But then again, you do have the degenerative model of low back pain. And once again, we go into that. We see that joint degenerate, causes compression. The gel from the disc has to go somewhere. Generally, it goes posterolateral, and that starts to ding the sciatic nerve. To be honest with you, somewhere on here, there is an example of one of my favorite things to do is decompression. Pretty much all the patients love this. Here we are. Now we're going. And so you will see as that opens up, as the thing slides apart, that opens up that joint space, allowing that into there. I have one of my patients saying we need to start adding trigger points into the wellness visits, and we can do that, absolutely. We do that either with the massage gun. I can use my elbow. We do acupuncture. We put stem on it. There's a whole bunch of different ways to do that, and gladly. I'm teasing one of my patients. I won't put his stuff up on the screen unless he wants me to, but we dig into the piriformis muscle, getting that to relax. So next, let's look at those structural issues. And what you're seeing there is a somatic reason, a body response reason. And that body response reason has a physical, tangible reason for it to happen. And the reason why I'm talking like that or saying that is because you can also have what is called a psychosomatic event. So if you are having stress in your life, the boss is being a tool, the family's got COVID and you have to stay home now for 2 weeks, but you really need to be at work. These things all cause tension. And you've heard of me talk about this in other podcasts or other videos where that tension will start to increase what is called cortisol. Cortisol will then, that's a stress hormone, and that starts to raise your body's stressors. And you start to get all the little factors going off, your tumor necrosis factors, your interleukins, all of these things start to fire off. And that's called homeostatic load. So we've been trained by, even my chiropractic training, we are taught that, you know what, if you do the right adjustment at the right time in the right area with the right force, all these things being right, if you do that, then what happens is you get the perfect adjustment and all is well. And now that doesn't work that way. Homeostatic load says, hey, I have mental stress. Hey, I have physical stress. Hey, I have biochemical stress. Let's say we're addicted to sugar, we eat fast foods, so we have a lot of calories, but they're empty. So the body has to work a lot. These all raise homeostatic load on the patient. And so when we're looking at that, this is the way, almost caught it on the bounce. This is the way we're actually trained, where we see, medically you're going along, you're doing great, and then you're just broke. Well, how often does that really happen? I mean, unless there's a trauma involved, that doesn't happen a lot. So what we really look at is you have optimal function, and then you get some compensatory function or dysfunction. And that's where we're sitting there saying it's a continuum. So for back pain, when we look at this, if you have the mental stressors going on and you have blood sugar issues going on, so you have insulin that makes you pro-inflammatory, all of these things lead to stressors on the back. And where are the kidneys, which are a set of filters, located? Where's the liver, which is a big filter, located? So if you have your liver and kidneys and all of these things working overtime to clean out environmental toxins, fast foods, all of that stuff, then everything gets backed up and mucked up. And when that happens, you start to get what we call a visceral somatic response. So then what happens is the nerves that lead to the large intestine, the liver, the gallbladder, the spleen, all of these nerves are always super excited. And guess where they refer pain back to? Looking into the thoracic spine. That's all right in this area, and then down into the low back. So you get this referred pain pattern. And This is the patient that when you're adjusting this patient, they adjust well, they get a little bit of relief, it lasts for a little bit, but then it comes back and it keeps coming back and it keeps coming back. Then patients in my practice, historically in the past, start to go to the pain center and they want injections and they want this, that, and the other, which is great for the short term. But if you're really not getting into the cause, these patients disappear for a while, several months, and then they come back after they've had their 2 or 3 or 4 steroid injections, whatever the doctors will do, and then they come back because they never really addressed the underlying cause. And so we work on homeostatic load here. We want to try to address all the different components that cause stress, whether it be mental, physical, emotional, spiritual, whatever those stresses are. We want to address those stressors and start to put plans in place, because that's the cool thing. The human body wants to be well. You give it the right food, you give it downtime, you let it relax and repair. Guess what's going to happen? Homeostatic load's going to drop, the body's going to heal, and you're going to feel better. Adjusting does a fabulous job of that. Acupuncture does a fabulous job of that. Physical therapy with the adjusting does a wonderful job of that. These are all things that we have to do, and we have to lower that homeostatic load on the body, allowing it to heal. It's wonderful when the adjustment is a quote unquote one and done. And it's wonderful when we can adjust, the patient gets their ranges of motion back. We start to see the changes on the x-ray. I take pre and post x-rays. We start to see changes on x-ray that allow us to send you home with like the Degeneration and keep on working on the curves. But if you're not getting good nutrition, if you're not getting good downtime, if you're not getting good sleep, these things will always stay tight. They'll always stay irritated. There's always static in the system. And so listen to your body. And most of my patients know when they are having a problem and what the problem is. Is it, one of my patients is an alcoholic, and when he falls off the wagon, he gets highly inflamed and he comes in, gets 2 or 3 adjustments, gets back on the wagon, and slowly but surely he heals up. Myself included, I'm, I will sugar binge every now and then. And once again, the insulin levels go up, and then I can start to feel that tightness in my back. I get adjusted twice a week. And as I get adjusted twice a week, that always keeps me pretty much in line, so that that's not one of the stressors. And those are some of the issues. The other thing is we really don't pay a lot of attention to how we move and how much motion we lose. So one thing that you should be able to do, I'm going to put this over there on the door. And so one of the things that you should be able to do is you should be able to squat. And if you want to have a long life where you play with grandchildren, great-grandchildren, and the such, you have to be able to receive the child down on their level. So you have to be able to do a squat. And in the beginning, I tell my patients to start at the door. You want to be close to the door, because if you fall backwards, you want to grab. You don't want to fall backwards. So you should be able to do the squat. You should be able to get below 90. And no, yes, it can be hard on the knees. If you have inflammation in your body and you're doing this motion, it's going to be hard on the knees. But if you don't have a lot of inflammation in the body and you do this, the knee's meant to do it. So can you do it? That's a question. But this helps open up the hips, and you come up and you can go. So you want to be able to plant the feet. You want to be able to go down, receive the child, bring them in. Oh, I love you, blah, blah, blah. And then you want to come up with them. And your legs should be able to do that. Another thing that I have patients do, especially for the Piriformis Syndrome, if you have a Piriformis Syndrome, pigeon pose is a good one to do. So if you get down on the ground, and I don't know how well you can see this, but you see right now, my left leg is fully extended back. I'm going to take my right leg and cross it over to here. And as I do that, I can feel that stretch. And you feel it in the piriformis muscle. So then you can start to stretch that actively on your own. And so then the lower you go, the more you feel that stretch. And you want to have that flexibility, because if you don't have that flexibility, you're probably inflamed and you're probably having an issue with the, I just noticed that says talk at 10 headaches. But you want to have this flexibility, and you want the piriformis to be able to move, to be able to stretch. This allows the body to stretch that gently. And this is a great way to do that. If you wake up in the morning and your back is stiff while you're laying there, probably going to have a hard time seeing my legs, but you're laying on your back, let your legs fall to one side, let it stretch, try to keep your shoulders flat on the ground, and then go to the other side. Do the same thing. After you do that a dozen times, take one leg, go over the other, cross it at the knee. Then you're going to reach through here, grab that knee, and pull it towards you. Once again, that's a stretch for the lumbar spine and for the piriformis muscle. So those are all things that you can do at home. And you take care of you, because that's what you want. We did touch on stress, psychosomatic. The biochemical issues are just getting unbelievable. It amazes me. I've done several recent omega-3 fatty acid tests, and the tests keep getting lower and lower and lower. And you're looking at the lowest I've had to date now is 3.8. What does that mean for that patient? We haven't done an NMR. The only thing that tells me is he is starting to set himself up for cardiovascular issues. I mean, that's what all the studies on EPA and DHA are about. It's cardiovascular issues. It's brain health. The more I read about DHA, the more DHA has a lot to do with the brain. And I was just listening to Dr. Atiya's podcast about the brain and how it loves DHA. And when you need, the body goes along for a long time. And then there's like this point in time when it stops getting DHA very well. And those are the things that actually kind of scares me, because when you can't actually absorb the DHA, does that mean it's kind of like a bank account and you've had to save this up for so long, and then it just stops and now you're taking out the principal? So that's why I mean, plantar fasciitis. We're talking about low back pain. We'll talk about plantar fasciitis. A lot of the people that I see that have very low omega-3 scores also have plantar fasciitis and pain in the foot. They have nerve type pains because that lipid layer is what works on nerve transmission. So biochemically, there's a lot of things, check out the homocysteine, check out the C-reactive protein, check out these things that are just baseline inflammatory things for your back. because it affects everything. If that's in your blood, it goes all over your body and it affects everywhere. That says talk it. I still kind of giggling at the banner saying the wrong thing. Psychosomatic, talked about stress, talked about homeostatic load, talked about visceral somatic, biochemical and structure. I mean, chiropractors, we are the absolute bomb at doing structural issues, adjusting people and getting the range of motion back. So when people come into Integrated Health of Indiana, we do an initial exam, we take range of motions, we know what the ranges should be, we make sure that you're within those ranges. Otherwise, we start to work on those. We do x-rays, we compare your x-ray to a normal x-ray so you can see what it should look like. Most people are pretty amazed. We do postural exams, and that's all part of the initial exam. So you come in, you get the triage, blood pressure, all of that stuff. We do the ranges of motion, we do the posture, we go in, we shoot x-rays, and then I've got to sit down and put all of this together to see how we can help you. And after we do that, we start the process of getting you better. Do we have any questions? I'll be happy to field any questions right now while I see if I can figure out what is going on. I'm simple-minded. I can only do one thing at a time, multitasking. All right, let's see how that does. And let me get back over to the comments. See if we have any comments there. So far, we don't. But does anybody have a question on back pain? What kind of back pain are you having? Are you getting some issues with radiating down the leg? Lay it on me. I have no idea how to get rid of the talk at 10 headaches. That was our last week's. I think next week I am going to dig a little more into the homeostatic load. So, well, if there aren't any questions, I think I will wrap this one up and get ready to see patients this afternoon. Thank you all. Have a great day. Be safe out there. It's snowing in Indiana. Don't want any accidents, and don't hurt yourselves shoveling snow. All right. Have a great one.